The first thing I wanted to talk to you about today is breathing for the pelvic floor. So, pelvic floor, and also just deep core reigniting, reintegrating, reconnecting between our brain and our body. So, a lot of us aren't breathing deeply very much throughout our day, and we're certainly not taking diaphragmatic breaths. And what that means is that we're not using the full expansive muscles of the lateral costal muscles here, the muscles in between the ribs can actually move quite a bit to support us to take deeper breaths. But if we're not using them, they just kind of get a bit stuck and rigid, and we're just kind of breathing mostly in our chest, that kind of more shallow breathing, or we're just kind of breathing into our tummy and we're not actually fully expanding. So what happens on the inhale in an ideal situation is that the diaphragm, which is a little muscle here that kind of separates the internal organs from the upper internal organs in the respiratory system, it kind of drops. So it drops down, and that allows the lungs to inflate and the ribs to go out. So inhale. Yes, you'll notice that the belly starts to fill with air. Of course we want that to happen, but we want to then start to move some capacity into the side ribs. And we'll practice a couple of ways of doing this. Well, actually, let's just do it right now. So I'm going to grab one of these. If you've got a long band, or even just like a piece of material or a scarf, it can be nice to kind of wrap this quite reasonably firmly around the back there, and just kind of practice taking a deep breath that actually expands the band out to the side. It's only very subtle, but that's going to start to get you breathing so that the diaphragm is dropping down and the ribs and the lungs are expanding and filling with air. And that is, like, actually, research shows one of the most important factors for postpartum rehab in terms of core strength and restoring diastasis recti. So any separation of the abdominal muscles, we all get some of it, it's just what degree, is called diastasis recti. You get measured in terms of how the finger width, but all of us need to work on reintegrating the abdominal muscles regardless of what finger we get. And often we're just told, don't do core work for X number of months, like don't do planks and sit-ups for 3 months, and then apparently you'll be okay to do those things. But from what I've learned, from what I've read, and what I've learned from other much more expert trainers and physiotherapists and pelvic floor specialists out there, is that it really depends on how you're doing the exercise rather than the time that's passed, or whether it's safe or not safe. So one of the major things that they talk about in terms of the quality of the rehab and the state that the body's in is, can you take deep diaphragmatic abdominal breaths, and that's something that we want to work towards. We want to continue to do that while we then go and do a plank or a core flexion, like a sit-up, a spinal flexion. So let's just practice taking those deep breaths here for a second. You might just use your ribs as your hands on your ribs as a little bit of feedback. Draw the head back in space, back of neck nice and long. Soften everything, seeing if you can just soften slightly through the pelvic floor, through the tummy. And then we'll inhale, soften, fill, and inflate the belly. Inflate the ribs out to the side, expand, take up so much space, breathe. And then exhale, notice the ribs start to contract and sink together. Notice if you can then start to wrap the lower belly in, almost as though you're pulsating at the rate of your breath. Inhale, expand, soften the pelvic floor, fill the belly. Take up space in a 360-degree way. And then exhale, you start to slowly contract and wrap, and it's like all of the core, all the front abdominals, yes, but the transverse abdominals, the side waist, even the back body, it's like it's squeezing in to gently hug around the spine. And then with that, of course, we've got the pelvic floor contraction as well. A couple more cycles. Inhale. Exhale. I'm gently squeezing and lifting and closing off any light that might be shining out of my pelvic floor if I had it relaxed. And I'm gently hugging everything in my core into the midline, into the center. Inhale. Exhale. Squeeze and lift. And this is a much more integrated way to restore the core and pelvic floor function than just randomly flicking your pee like you need to pee, the stream of urine on and off, like just a Kegel that's not integrated with the breath and with the whole core. So I would really encourage you to just do that when you're doing anything. It's such a nice mindful thing as well. You know, you can be doing it not in a really obsessive way, but just when you're doing the dishes or folding the washing or even walking, you know, that can kind of take another level of concentration. Take some deep conscious breaths, and on the exhale, active contraction and wrapping in the front body, the back body, the side body to the core, to the deep, deep core, the spine. Really, that's what the role of all of our muscles around our core is. It's to protect our spine and to keep us in extension, standing up rather than, you know. So yeah, hope that is helpful, and try and do that a couple of times throughout the day, you know, 5 nice deep diaphragmatic abdominal breathing, and notice if we can then start to integrate that into the practice as well when we move on the mat more formally. Okay, thanks so much. Take care. Bye.